Call now.
Mom was diagnosed with Alzheimer's at 58 years old.
This disease just ravages a family.
It changes your life. If we work together, we can stop this epidemic. Now is the moment.
Contact Bright Focus and learn more.
Politics, commentary, entertainment, sports, news and opinion now. Here is Steve Malzberg.
Back here, the U.S. Border Patrol says it has stopped sending Central American children and families to San Diego after they're arrested in South Texas. The experiment sparked quite a backlash in one California city when protesters blocked a road and forced busloads of immigrants to reroute. Meanwhile, on Capitol Hill, lawmakers are working out a possible compromise to deport migrant families more quickly.
And the U.S. Border Patrol says it will no longer transport migrant families who cross the border to a facility in San Diego. The first buses to attempt the trip were blocked by protesters and forced to reroute.
Otolaryngologist, otolaryngologist, otolaryngologist. I said it correctly 3 times, I think. That's because our next guest, Dr. Elaina George, is a board-certified otolaryngologist. And that's video you saw. They made a point on those 2 networks not to say illegal at all. But let's welcome in Dr. Elaina George. Did I say it correctly, doctor?
You certainly did.
I will pat myself on the back, or on the shoulder anyway. Can't reach my back. All right, well, thanks for joining us. It's not a laughing matter. I appreciate you coming on. We have heard so much about the possible threat of disease and illness coming into this country from these children who have crossed the border, who are being housed together. First, let's talk of the threat to them before we get to the threat to us. When you bring all these kids from various countries together and you don't know what vaccinations they've had, I don't even know what those Central American countries do for vaccinations. You don't know what they have, what they're carrying, and you put them all together in these close quarters and keep them there together. What's the health threat to them?
It's absolutely a threat from anything that's airborne. The fact that people are in soiled clothes, they're being exposed to human waste, and they're all in heated conditions. I mean, it's like a perfect pressure cooker. It's like a culture medium, if you really want to think about it in that manner. And 1,700-mile trek by foot, by train, or however else they're coming up. They haven't been fed, they're dehydrated, their immune systems have basically taken a major hit. And you have to remember that they're young children, so they don't have a lot of reserve to begin with.
Yeah, no, that is awful. Now, we don't know, I don't believe, and maybe you could tell me, we don't know exactly what the outbreaks have been at these camps, if any, how many are sick, how many are in isolation, because even Congress people can't go see these children, and any reporters that go can't bring a camera, can't bring any recording device. It's just it's horrific to think that this is the United States of America. So do you know more than I know? Are there any figures out about illnesses that these children are suffering, again, while they're not isolation, but in captivity, if you will?
I think we need to be clear that they're not in isolation. And I've seen some of the news reports where it's yellow, kind of crime scene tape, basically separating people who are ill from healthy people. So everybody's sharing the
right.
same
I didn't mean to say isolation.
No,
I didn't mean to say isolation. Yeah.
Just wanted to paint that picture so people understand that even if you're sick, you're still being exposed to people who are supposedly healthy. I don't have numbers, but I do have anecdotal information from nurses and frontline health professionals that say that they're seeing people with active TB who are coughing up blood, who are short of breath, who are physically in the throes of active TB, and they are communicable. And that's what you do know.
All right.
So you have scabies, you have all sorts of things.
I'm sorry to interrupt. So now when these children are flown to various parts of the country, as we know, that's the plan. Not only have we seen them arrive on buses or attempt to arrive on buses, but now we know the president is asking governors of various states to accept these children. I would only imagine and hope that they wouldn't be sending those who they know are infected and are exhibiting the symptoms you've described. But nonetheless, what's the danger in sending the ones who are not exhibiting the symptoms but have been held in these kinds of places?
That's an excellent point. Not everybody shows symptoms right away, but they could have, the disease before it actually manifests or shows itself. So they're just as infectious. And they're putting them on commercial airliners. And, TSA has been ordered to stand down and allow these children and adults to get on planes without ID. So they're arriving in Georgia, they're arriving in Maryland, they're arriving all over the country. And there's now a story, I don't know if you've read this recently, but in Maryland, there was an illegal immigrant child who has TB, and the parents just got a letter from their school stating that their children have been exposed. I believe there's going to be a lot more letters like that going out, if parents are lucky.
Yeah, this is horrific. Talk about, if you can, list the possible illnesses that these children coming from these countries might have. I mean, I certainly could guess, but I know TB, and include in there the antibiotic-resistant form of that as well.
That is the most frightening part about TB. In the past, they had treatments for it, but now it's become so difficult to treat that even as a healthcare worker, provider like myself, we have to take tests every year and actually do questionnaires to make sure that we are not able to pass any diseases. So you can imagine if the healthcare professionals are being put to this type of, glass, to make sure that we're doing it. You can imagine what happens when you don't check. So there's measles, there's mumps, there's chickenpox, which most of us have been vaccinated for, but infants haven't yet, and the senior citizens are all at risk, or people with HIV or other immune compromising diseases are at risk. Then you have scabies, you have tuberculosis, you have dengue fever, all sorts of tropical diseases that I, as a healthcare professional, don't have a lot of facility with because I don't know tropical medicine. So I can foresee a lot of pediatricians, ENTs, people on the front line are going to have to really brush up on tropical diseases so that we know what we're looking at. It's just the tip of the iceberg, I'm afraid.
And parents, if these kids come into their neighborhoods and schools, should be, I guess, very concerned, correct?
They should be. I mean, children are known vectors anyway. Runny noses, they play with each other, they touch each other, they touch their nose. The parents pick them up. I mean, just imagine how easily this can be transmitted through a family, for example. And my problem with this is that the government has no regard for us as American citizens. Look, my dad was an immigrant. I am not against legal immigration at all. But the way this is being done, it is being done haphazard, and it's all about winning at any cost. And it's political strategy without regard for health. And once these things get a foothold in our country, we're a problem.
Yeah, no, Doctor, thank you for educating us, and it's a horrific situation. Thank you very much. We'll speak to you again, Dr. Elaina George.
Thank you.
We'll be back with more of the Steve Malzberg Show, ladies and gentlemen, right after.